Good evening, everyone. Thank you for being here. My name is Meg Lockwood. I am interim Alston Burr resident dean of Cabot House, and also really grateful to have the opportunity to serve as co-chair of the COVID Community Council. I have been working in the Harvard College Dean's Office as a special advisor for all things COVID related, and I think this is a really important piece to how we're going to support our community this year. So glad to have a chance to be here with you tonight. I'm so fortunate to be joined by Dr. Brett Flehinger, who's our Associate Dean for Academic Integrity and Student Conduct. And we're looking forward to sharing with you a bit about our plans for supporting our students with the Community Compact and really having time to answer a lot of your questions. Brett, would you share your screen and pull up our slides? Great. So we'll just start with a few minutes talking about the compact. We'll introduce the role of the community health leads. Then we'll spend most of our time talking about the community council, how it is being set up, what we expect, how we expect it to respond to instances of noncompliance that might arise during this academic year. We really appreciate those of you who submitted questions in advance. We're going to try to answer as many questions as we can, starting with your pre-submitted questions. And you can also give us your email address. So if we don't get to your email, get to your question, we can email you back with a response. We'd like to ask that you use the Q&A feature for questions that you want us to answer, and then the chat for technical difficulties. We're here to help you with all of it. So with that, Brett, I think we can pull up the compact and start to talk about that a bit.
Yep, and so I'll just be totally honest, this is just completely a placeholder sign because I was afraid I would forget to show you the compact, so we can get away from that and go straight to the compact itself. So this is the residential community compact as it appears, precisely what you will be agreeing to. If you're coming on campus. If you're not, it is not going to be something you're directly there. So we just want to walk you through it. I'm going to talk about it probably at a little bit of a sort of abstract level, and then Meg will go into some of the details. So the part in red is the part in some ways that matters, not the most, but that it is, I think, a place to start. When we put this together, what we started with was, okay, there's two different ways that community matters. One is this is a virus that works through the community. It works through my close contact with Meg, brushing up against her at the market or sitting there, and being close together at a dinner or something like that. And then it spreads to Meg's family and back to my family. So the first thing is, it really is going to spread along the community. The second is that we actually have each other's safety in our hands. Part of the reasons we wear masks is to protect others more than we protect ourselves, right? It's something that you can do for someone else more than yourself. And ultimately, this is going to be a test of how well this community can function. And our sort of virus rates will tell us that. So when you come on campus, you're not just protecting yourself, but you're taking on the obligation to share and protect others. And to first-year students, I'll be really honest. The senior spring at some level is in your hands, right? We want to bring more students back, and it's going to depend on all our ability to do it. So I think the way I would think about it is that, we start with the community, that the solution is actually the community, and that this is going to be a test of the community. That's why we also have these guidelines here, things that we just want to be clear that you're agreeing to when you come on campus. Also because our goal is to get you to happily agree and keep everyone safe. Not to just enforce things. Meg, you want me to advance?
Sounds good. So I know you've seen this before. I just want to double click on a couple of points here. So in terms of required testing, education, and contact tracing, we're so fortunate to have, to our knowledge, the most comprehensive testing plan of any university that we know about. This testing, as you know, the tests don't cure the virus and they don't prevent the virus, but what they do is that they can catch asymptomatic carriers of the virus before they become symptomatic. So we can quickly identify positive cases and help people stop from spreading the virus further within their community. So we're so fortunate to be able to do that. We're working on ways to make it really easy and routine for all of us to be a part of. I actually have a sample test kit here if you're interested. This is what your test kit will look like. So we're working with this company called Color as our partners. Each of the kit has instructions. You will activate your kit using this unique barcode, which I know some of you got an email today who are coming to campus about setting up your account with Color. So they'll know who you are, and then they'll know from this card that you are linked to this individual tube. You get a little, this is basically a little Q-tip. So this is not the like stick all the way back in your brain kind of swab. It's just the little tip that goes into your nose and it doesn't hurt. And then you will put the swab in the tube. And so we'll send these off to the Broad Institute for analysis. So anyway, that's just a little preview of what testing is going to look like. But if you remember one thing, just remember the instructions are all there and it doesn't hurt, and it's a huge help to the community for us all to participate. I want to emphasize the second bullet. If I test positive for COVID-19, I will share truthful information with the contact tracers and others who may be at risk. I want to be really clear that contact tracing, that will all be organized through Harvard University Health Services. So that will be a public health effort. Contact tracing, any information that you provide to a contact tracer. So if you test positive, they're going to call and ask you, can you try to remember everyone you were with for the last 72 hours? I'm not sure how many hours, some period, some number of hours. And you're going to try really hard to remember every single person you saw, because those people, if they might have tested positive, they really need to quarantine until we can be sure that they weren't infected. So that anything that you would tell a contact tracer would be completely confidential. We wouldn't know about it. The college wouldn't know about it. The council wouldn't know about it. You would never get in trouble. It's as confidential as any other medical information you ever give to a medical provider. So I want to make sure that we're super clear on that.
Can I add something on that, Meg?
Yeah.
Yeah, I also want to add is like one of the, I work on the Honor Council on the administrative board, and we'll be working with the community council. Our goal is to keep people safe. Public health requires confidentiality. We don't want that information. That's not what's going to keep the community safe. Contact tracing, testing is going to keep the community safe. And when people are safe, people can learn, and we'll be in a lot better place.
Thanks, Brett. So then another really important piece of our policies are the self-isolation and quarantine. So we want anyone who's at high risk for infecting other people, so people who have tested positive, and then people who have been close contacts with those who have tested positive, to be kind of out of circulation and not infecting other people. So complying with quarantine and isolation procedures is super important. We know that this is not going to be easy news to get if you find out that you've tested positive. You would get a notification. You'll get an automatic text and email to say that you have results. But if you check them and find out that you tested positive, you should know that UHS, University Health Services, they're getting the notice at the exact same time, and they're going to reach out to you and tell you what you need to do. We're also planning for in everybody's dorm room, you'll have the procedures for isolation posted in your room. So if you get that unwelcome news in the middle of the night, you'll have a piece of paper there that will tell you what to do. So I hope that that is comforting. Please know that UHS will be taking really good care of you and checking in with you. Also, your resident dean will be checking in with you and making sure that you're doing okay. So we'll really work to guide you in a very supportive way through this process that, we hope that we don't have to do too many times, but we're prepared for it. You'll receive the seasonal flu vaccine. You'll comply by physical distancing, face covering, and behavioral requirements. So, like I said a minute ago, the testing and quarantine, they don't actually prevent well, quarantine prevents the disease from spreading, but like the way you're really going to keep from getting and spreading the virus is by wearing your face covering and physical distancing. So that's absolutely crucial, that we all get in the habit of doing it. And I know many of us are, just from having lived in the world for the past 6 months or whatever it's been. So one other thing that I wanted to highlight is that we have faculty members, epidemiologists, physicians, a microbiologist, who are going to be preparing a series of short videos about the science behind these policies. I'm really looking forward to them, so keep an eye out for them in the next week or so that then you can educate yourself about, well, this is actually why we're doing this particular cadence of testing. This is the model that we based it on. It's super interesting and makes me wonder why I was so not interested in anything to do with science while I was an undergrad, but I've come around. So Brett, could we go into the next slide?
I just want to add one other thing. On the sort of fifth bullet point on the physical distancing, if any in-person gatherings are allowed future time, et cetera. The idea of the compact is that we can adjust. The idea for the whole campus is that we're going to start off cautiously and that we can adjust if things go well. We really want this to succeed, and we're going to start off cautiously and then think about the options. So part of it will be for you to inform yourself of what the guidelines are in the event that things are able to change. But yeah, I'll move forward, Meg.
Cool. Okay, so hygiene, cleaning our residential spaces, practicing good hygiene. So you'll notice when you get here, there is hand sanitizer everywhere. There are little paper towels that you can take to then touch an elevator, like an elevator button with a paper towel. So our colleagues in physical resources and environmental health and safety are doing so much to try and make this really easy for us. Travel. So the idea is that to keep our community safe, we're agreeing to remain in the immediate area for the fall semester. We can foresee some reasons that students might need to travel. So I hope this is not the case, but I could see if somebody needs to go to be with a family member, to go to a funeral, those would be reasons why I would think resident deans would grant exceptions and permit people to travel. You would need to make sure, of course, when you get back, whatever policies for quarantine are in place. Like I think everyone knows Massachusetts has a quarantine policy in place right now. We would need to make sure that you were following any policies, both from the state and from the university. And then as you know, because I think you had to enter this in when you checked in to register for courses, you need to have a plan that we hope this won't happen, but in case it does, that we need to de-densify the campus, that you have a plan to travel away from campus. We're agreeing not to have guests in our residential suite, so not having anybody not assigned to your residential suite in your suite. And the reason is really, I guess I'll read the other ones as well too. Only accessing your own building and not providing access to Harvard buildings to anyone. As I think you probably know, just from all we've learned about the virus in the past few months, the real danger of transmission is in confined spaces, or the highest danger. So we're really trying to keep our interior, our buildings, only to the community members who are living there, to keep the community safe. So this compact, we really want to encourage you to read over and over before you come. It's really important that to know that you're making a choice. So if you find yourself that it's really not working for you to be here and comply by this compact, then it's probably not working for you to be here in these circumstances, which of course we all wish were different, but this is the circumstance that we're in. What else, Brett, what else would you say about that?
So the other thing I'd say is, I think the structure of this, the enforcement part at the end, under the little house, if at any point I find I'm unable to comply with the rules, I will remove myself. I may be asked to do so. We put this at the end for a reason. You could put it up front, which would be a way of loading it and saying, hey, look, we mean this. And we do. Like, we want people to be safe. But, and we'll talk more, removing students from campus is going to be a last resort. It's going to be something that we have to do to keep the community safe. So a way of thinking about this, is that these are guidelines to keep yourself safe, but also keep people that you care deeply about. Like I've been here for 30 years and students love each other. Okay, this is a time that we need to step up for each other.
And I think that what we'll show next, Brett, is a slide about who is going to be taking the lead and helping us step up for each other. So we are very fortunate to have a outstanding cohort of community health leads. And so you can find your house or yard. And so these are tutors and proctors who have stepped up and said, I want to be a leader in this crisis. I want to help make this work. I want to help make sure that people know how testing is going to work, and that they know where they're supposed to go and what they're supposed to do. I want to find ways that we can make this fun and that we can all really understand why we're doing this. We're doing it for each other. And we can work together to support each other in complying with the compact. So I'm really looking forward to working with these people and grateful to them for their service.
That also leads to me unmuting myself. So that leads to the council. And we're an educational institution, but we're going to have more than 1,000 people on campus. And hope as we might that everyone will be perfect, we have to be realistic that people may not be able to follow every guideline. And so there is an enforcement mechanism, and it is going to be shared by the community. And I'm going to talk about our goals a little bit before we get into the brass tacks of it, about what's going on. But our broad hope is to get you to agree to measures and voluntarily work on measures that will keep everybody safe. It will be easier, it will keep us focused on learning, and it will be much more successful. So when we had to put together a body, we put together what we call the Community Council. And our first emphasis was that it's non-disciplinary, which is unlike the administrative board. It's not going to do something that's going to go onto your transcript or your record, or similar with the Honor Council. Instead, it is going to work in ways to try to keep you in housing. There will be warnings, and I'll walk through that in a number of ways. The second meaning of non-disciplinary is that it actually really can't suspend a student, it can't put them on probation, but it can say, look, you're no longer able to live in Harvard residential housing. Emphasis in remote education, that doesn't mean the semester's over, but it does mean that that student would need to go home. That's not our goal, that's our last option. So our purpose is to keep the community safe and to be a backstop for the community. And our values are broadly educational values. And I've been doing this for a number of years, and I'll put it in a couple different ways. The educational values and our goal is to educate the community in advance. We want you to know, we want you to agree, we want to hear from you. That's why Meg and I are here at this point. And we want to hear back from you tonight and in the future. But we also want to educate those who aren't following the compact. So, if Meg is doing great, she wears her mask, she stays 6 feet from people, sometimes even 7. I'm not so good at it. I can't really sense what 6 feet is. I'm a little right up in people's faces, don't remember that mask, and so I'm having some problems. Part of it is to educate me, not just, hey, Brett, if you don't wear the mask, you're not gonna be able to stay. But Brett, when you don't wear the mask, you're actually endangering everybody, right? The mask isn't protecting you nearly as much as it's protecting everyone else. And let's think about community values. So that's part, I think the educational goal is much broader than that. And that leads to the next part, which is it's built on a shared responsibility model. So there will be 10 members of the council, and we will work to the student members almost immediately after this meeting. Well, maybe not tonight, tomorrow morning. But we've named most of the faculty and staff. You have to get a couple more agreements. But there are 5 faculty and staff, mostly house staff, who are on the community council. And then there will be 5 Harvard College undergraduates. My guess is more of them will be in residence than not, but you don't have to be in residence to be on the council. And the idea is it's everybody's community. And the virus is going to spread across the community if we don't do well. So we will share responsibility. We hope that that will give us credibility, and we will share the decision making. And ultimately, that's how it will work. We don't plan on a single response. Instead, we have planned a series of sort of stepwise escalating or increasing responses. In part, that's an educational way, but it's also part to maintain community connection. So, Meg is wearing her mask. I'm not. The community council, or the community health lead from my house, and I lived in Lowell House for a number of years. Lowell is special. So they come to me and they say, Brett, you're not, health lead comes and says, Brett, you weren't wearing your mask. You're not keeping everybody safe. I'll probably get an email that'll say, hey, Brett, get it together. That email will also go to Meg and me just for a record so we know. So I do pretty well for a while. The next week, I don't wear my mask again. Sorry. This time we're going to escalate it a little. Instead of it coming from a community health lead from house staff, that student's going to have a Zoom sit down with Meg or me and get a formal letter that says, we're warning you and this is what we need you to do. At that point, hopefully we have gotten that in. And I think I plan on spending 15, 20 minutes with the student talking about the responsibility and the help there. The next step would probably be a series of community responses. It might be the student writing sort of a letter or an essay about what the dangers are here. It might be something like restorative justice. We are looking for intermediate steps, and we would be interested to hear from you about ideas for a sort of community response. And then the next step after that would be to say, it's simply not working. The community is not safe because you're not at this point able to maintain responsibility in the community. So we imagine this going in a series of steps so we can educate someone. And so our last response is to remove someone from housing. The other thing I will say, and I see questions are popping up, but I don't have time to read them. There are some things that will be large enough that will have a student be removed in a single act. So we will talk about more of those. We're going to try and be as clear as possible. We're going to try and be as available as possible. One of the good things about Zoom, it doesn't mean that somebody has to travel to go to a meeting. You flip on your camera. So I think we're going to be as available as possible. The last part is, I think, really separate. The administrative board still exists, and there may be some disciplinary issues that come up, but those will be traditional disciplinary issues. So we're going to separate the council from disciplinary issues. If I, as a student, do something that violates the handbook for students, I may have to deal with that. And so the way I could kind of think of this as overlapping is, and I keep being, let's make Meg the example. So I've been very good. I've been wearing my mask. I got my warnings. I paid attention. Suddenly, Meg is not paying attention anymore. Meg throws a party, and in that party, things get a little out of control, and Meg, and I'm sort of being mouthy because I'm wearing my mask and being very responsible, although I guess I'm at the party, so that's not working so well. But still, you get the point, and for whatever reason, Meg hits me. Thanks, Meg. So the party itself, that's a community council issue. The hitting me, that's just a handbook issue. Harvard students, Harvard faculty actually for that matter, aren't allowed to hit people. And so the administrative board will deal with the physical violence and the community council will deal with the party. I'd hope to not see that, but you never know with Meg. So that's the council. There are many other issues. We'll be happy to take questions on that. And with that, we're going to go on to a few of the questions you've asked. We've taken a sample of those, and then we're going to go to the questions that have been submitted. I guess there's 10 there. We'll look at the upvotes. And I can't remember the order, Meg, but let's scroll forward and see. Is the first one mine or yours?
I think that's you.
Okay. So I'll read them just to make sure that we have them, especially the one that says, hi, Brett. So other colleges are including off-campus students in testing and the signing of community compacts. Even though Harvard doesn't typically have students living off campus, you must be aware that sophomores, juniors, seniors are renting, and then a list of places. And I do know those places. I used to go to those places in the old days when we had fun. Well, they take classes online. Even though students are barred from entering campus, what about Harvard's obligation to those neighboring communities? So we, to be honest, and to be clear, we've set up a high cadence testing and tracing system that is for residential living to make sure that our concentrated spaces, which somebody likened to fixed cruise ships, don't end up like cruise ships. So the testing is set up around that. But at the same time, the other thing I would emphasize for students who are living in Kendall Square, Somerville, Alston, et cetera, is that those are pre-existing communities that have both community standards and public health laws and public health officials. Those students will be expected to follow those, and it will be important that they do so. So as students go out into neighboring communities, they go out as Harvard students, they go out as Harvard ambassadors, but they also just go out as citizens of those communities that have the obligations, just like people in Cambridge have an obligation to their neighbors. So that's the first answer to that question. I kind of feel like we answered the second question. But I will say, I don't love the 3 strikes part of the question. It's not, this is not a judicial system. Instead, we are trying to work with people to keep a community safe. And I think thinking of it that way will make it harder for all of us. I think we're all going to have to be flexible. We're also going to have to listen, and we'll talk a little bit more about communication. So now we go, God, all these questions. I think I probably take the 3rd one. When we read the questions last night, this made my day. I don't know if this is a person I know or not, but anyone who sends in questions that starts off with "Hi, Brett," and 2 exclamation points is okay with me. And before I read it, I'll say, this is an incredibly good question, but it's actually not embedded in COVID. It's actually embedded in residential living. So it says, how does the community compact, or the community council, depending on which the CC this is, we always do this, they always back up on each other, recommend we have discussions around shared spaces, whether that's the suite or bathroom with people they may not know. In other words, should I ask my roommates, or should I ask my roommates, I share a hallway bathroom with, where they have been or where they've been socially distancing. In terms of personal questions, how much is too much? I feel like we're in uncharted territories, and I'm not sure how to draw the line between those types of questions, since they are personal, but also if they haven't been socially distancing. I have the right to know. I'll get to the anonymous reporting, which I just think is a separate question in there. Look, the honest truth is, these are hard questions. But in a public health situation, what you may need to know about someone is different than you might need to know in another set of circumstances. In any roommate situation, whether it is a roommate you're assigned in college or a roommate you marry, or somebody you marry and kind of works as a roommate, but it's a little bit more than that, communication is going to be the key. And I think I would be honest and open up front, talk with them about that. You're all going to be coming in, you're all going to be getting tested early on. You have a lot of information. I would try and lay the groundwork for this. But this is something that college students have to deal with. Mess, cleaning the bathroom. You're going to have to clean the bathroom. So I think there's a moment of growth here. It's a challenge, and I would try and establish it from the beginning, because it does get harder. Meg, you live with roommates, a little one and a big one. So other things you want to add?
No, I think you got it, Brett. Communication is key. Also remember that you can take steps to keep yourself safe. Like, you can always keep distance and be really thoughtful about that as well. But I just completely agree that communication is key.
Okay. And then the 4th question is, we have heard of many students with positive antibodies, as there were considerable transmission at Harvard in February and March. Shouldn't these students be allowed back on campus? Is that a you or a me question, Meg?
I can take that one.
Sure.
So the decision about who would be invited back to campus this fall was really educational. So the idea was that students who needed to be back on campus in order to participate in academics and make the most out of the learning experience would be invited to come back, as well as first-year students, because we want to have you have a start to this academic experience in this physical location, in this beautiful campus, even though it's a little bit different, very different from usual. So that was the way the decisions were made.
So I also, yeah, and I also want to comment on that. There wasn't a lot of transmission in February and March. We were quite lucky. It wasn't a perfect send-off. Students spent a lot of time together, but the factual basis of the question is not entirely perfect. So with that, we will turn to the upvoted questions. Meg, you want to just take them in order and sort of work them out? Can you see them as well?
Sure, yeah, I can. And I also noticed we got a couple in the chat, which we could maybe quickly answer.
Yep.
So from Laura, does university provide face masks? Yes. So bring yours to wear when you move in, but yes, you'll be provided face masks. If we decide to leave campus due to our own safety, how does that factor into our financial aid? Do we still have to pay for our room or board, even if we choose to leave?
So the question, Meg, is if somebody leaves, what will happen to their room and board if they leave in the midst of the semester?
Mm-hmm.
I don't know the answer to that. Do you?
I don't. My answer to any questions about financial aid are always ask financial aid. But so
yeah, that's what I'm going to repeat.
We could ask them about that.
Yeah, if you leave mid-semester. Okay. I'm just writing that down. It's a good question.
Because
Uh,
usually if you take a leave of absence, it would be prorated. But this would be a little bit different. You'd still be enrolled, but leaving housing. Oh, I'm getting a text from a colleague here to say that it was prorated, but we're gonna double check.
okay.
Um,
So the top question seems to be, do you have them upvoted, Meg?
yes, yes.
So you want to take Lauren's? You want me to take that one?
I'll take Lauren's. If students are living in a suite with 1+ roommates, how will a positive test result impact everyone sharing the suite? Really good question, Lauren. So if you are living in a suite with someone who tests positive, you're a close contact with that person because you're living in a suite together. So you will be asked to quarantine. On the university coronavirus website, and I'm going to pull it up to make sure I'm giving you the right information. So if you are quarantining because you've been a close contact of somebody who tested positive, you'll stay in your room for the duration of the quarantine, leaving only to use the restroom. You'll continue with your prescribed testing frequency. To drop off, like if you're going out to take a test for an urgent medical matter or to evacuate for a life-threatening emergency. If you test positive for COVID-19 while in quarantine, you will be moved to isolation. So basically, once UHS will contact you if they know you've been exposed to someone who's tested positive for COVID-19, and they will explain this all to you. But what's super important is that like you quickly go back to your room and stop interacting with people, because if there's a chance that you could have been exposed, you really don't want to risk spreading the virus.
Okay. So why don't I take Andrew's question at the top, which now has the most upvotes anyway. Who would we be able to interact with in person after the first week? Who with masks and who without, or social distancing? Would we be able to have hall activities? So let me address that good question in a couple different ways. You guys can keep upvoting it or not, but we're going to answer it now. So the first week, as we've noted, there's going to be pretty tight quarantine. As you go, you can expect to continue to wear a mask. The idea is that you will wear a mask or face covering when you are outside of your room. You will continue to social distance. I don't imagine, if hall activities are defined as indoor, that we will see them. Indoor is one of the most difficult places, and that's one of the things we're concerned with. I think you can imagine a scenario as the testing goes well, as we are on top of it, that we might be able to relax things and you see students able to socialize outside, maybe be eating together socially distanced. So, I'm going to eat my lunch and Meg's going to eat hers 6 feet apart. That also keeps her from hitting me, so that's a good thing there. So we'll do that. We'll be 6 feet apart, and in a small group, a small handful of people, a single handful of people, maybe socializing outside in 6, 8 people like that. We are going to be, I'm just going to be really honest, we want to be really cautious. Our first goal, and I think one of the things that I look back now, and it's been a long 5 months since mid-March, the consistency with which people's safety and keeping students and staff and faculty safe has been one of the consistent things even before it got enunciated. And I think that will continue to be so. So that was a long-winded answer, and I think I missed a little bit part of it. No, I guess I got all of it. Yep. Let me go to Paulina, or Meg, which question do you want to take?
Oh yeah, I just want to take Charles's question. Is there a certain number or percentage of student infections that would warrant a dedensification of the entire campus? So let me say first, it is quite likely, given the prevalence of this disease in the country, that there will be people who arrive to campus who are infected and don't know it and test positive, and we're preparing for that. I think your question is a really good one, Charles, and I can assure you that it is being considered, at the very highest levels, really, of the university. And this is also something that, I can assure you that if as much as we have prepared, if it gets to the point where it doesn't feel that it's not safe, and the advice we're getting from public health experts is that we're not able to keep people safe in this community, then we would de-densify the campus. So I think that's how I'd answer that.
So I'm gonna take Paulina's question, answer it in two different ways. So the question is, what is considered the immediate area? I think it's a really good question because you want to be informed and you want to know. For the moment, I think it's pretty clearly Greater Boston. I don't know if it's defined beyond that. So I think, Meg, we've not put a precise definition on that.
No.
We will do so, and you will be able to answer that. That being said, I want to honor Paulina's question because what it does is it tries to get to what needs to be done. And I want to urge you to do two things. One is Harvard is notorious, faculty, staff, students, for trying to find the gray areas. This is not the moment to find the gray areas. The gray areas are dangerous to the community. I think this is a place to be as precise as possible. The second, and this is an email that I think went out from a number of deans that I read that I was pretty impressed with, which was said, you know, look, at this moment, we ask you, follow the letter of the law, but also follow the spirit of it. There is something bigger going on here. You are keeping other people safe, and you are working to enable other people to come on campus and get their education. Already we have seen other schools have to shut down. Our goal is to keep people safe and keep education working, and we all have to work towards that. So I think there's a broader issue there.
I'll take Andrew's question. So students and singles with no suite mates are just supposed to stay isolated alone in a room with no interaction. So, so let me first say that the guidelines for our initial quarantine that went out today, initial arrival on campus, we are absolutely going to be so cautious and ask students to stay in their rooms until they have their first negative test. And really appreciate people's willingness to do that because it's going to be a huge, I think, preventive measure that we're taking. So as you saw in the email, there will be your quarantine phase 1, quarantine phase 2, and then after and during your quarantine phase 2, you will be allowed to go outside. It's going to be beautiful weather, not to jinx it, but it's usually late August, early September is really gorgeous here. So you'll be able to walk around outside. And then as Brett said a little bit earlier, it is not our intention for you to stay isolated alone in a room with no interaction. We are, as soon as everyone gets through the initial quarantine safely, we really want to provide clear guidance about what it looks like to be outside, socializing safely, maintaining your distance, wearing your mask, but getting to interact with people and get to know your classmates.
So I'll take Sarah's question, which says, what will the eating in the dining halls look like and how many times can that move? What will eating in the dining halls look like? What explicit measures are being taken to protect the dining hall staff, given that it is a more high-risk situation for them? So I'll give you two sort of specific answers, Sarah, then speak to it more broadly. Early on, the food will be in the room. It'll be provided directly to you. Then you will be going to the dining hall and you will be getting your food from a socially distant space. So you won't be interacting with dining hall staff in a way that is too close. They are also taking protective measures and cleaning. But I think there's a broader thing, and I'm glad you asked that question because clearly you care. And I think this is the hard part. Every time we're having an interaction, we're affecting a whole bunch of other people. So when it is tempting to say, don't want to wear my mask, and like, I'll be honest, I forgot my mask when I went to go walk the dogs the other day. Somebody looked at me horrified, I ran back to the house, right? So like, it's going to be tempting. Or to say, yeah, like I want to go over to that person's room. But the reality is you are affecting other people, including people who have to work here, who need to come and take that risk because they need to earn a living. So again, it's a broader community interest, and it's something we're going to have to keep track of.
I can take the next one from PTT. On move-in day, is a student required to stay in the room immediately after unpacking? Can they run to the store once they see their room? Can a parent drop off supplies later in the day? So out of sincere desire to keep our campus really safe, you are required to stay in your room and guests are not allowed. The thing is, what we would, that's the policy.
Okay, can we skip and answer Evangelist's question? Because it keeps almost getting answered and then it gets up, somebody gets upvoted beyond it. And it's like the
Yes.
saddest thing I've seen. So we got to get this out of the way. It's going to make
And also, we know and love Evangelos. And
exactly.
Evangelos, I want to answer your question. And I love that you're interested in the science of this. Evangelos is wondering what happens to the test tubes after being analyzed. How will they be discarded? So I've just been in correspondence with the with Color, the testing company, and the Broad, where they are analyzing the samples, and they have been referring to tubes being destroyed. I don't know what actually that exactly means, but I'm curious now that you've asked, and so I will find out.
Okay, so then the question is, will a pod system, students who create a small group and only be allowed to see them, be adopted? We do not think at this point, Santi, that a pod system will be adopted, but students who live in a suite will essentially be in a family situation where they are able to be masked and there are not restrictions around them. So that's some of the interaction that we imagine, but we have declined to institute a pod system.
Do you want to take Braden's question, Brett?
Yes. How are undergraduates who participate in the council determined? So it is, they are appointed by the dean of the college, just like every member of that committee is appointed by the dean of the college. We are looking for students, Braden, careful, who will volunteer to do so. And we will be looking for students who want to take on this responsibility. We wanted to have this meeting, and that's the next step, starting tomorrow.
Andrew's asking if my family is getting tested before getting on campus for Massachusetts guideline reasons. Would that count for a Harvard test? I think the idea, Andrew, is that we really want you to have your test while you're here on campus with us. So you'll do that. That'll be the first thing you do when you get to campus. You'll get a super cool wristband after you take your test, and then that will be your ticket to go and pick up your key. I can take Maria's question about, is there any concern with false positives? So the tests that we are using are, let me look this up so that I don't get it wrong, are called, sorry, I've been told that they are the gold standard in testing technology. They are RT-qPCR. So they are as reliable as they can be. And the idea is that the program will be testing people so frequently that we'll catch that we'll try and catch things. I think that the false positive rate has been really low. I can't remember it off the top of my head. That's my non-scientist answer.
Meg, I'm going to get to some of the questions in the chat. I think they're ones you might want to answer, but I'll read them so you can take them. I can't remember the answer to this one. Does the university provide face masks?
Yes.
I will be bringing one. So great. Yes. So there will be no HUHS testing available for those living off campus.
Currently, the plan is that HUH testing will be for those living on campus here, undergrads and staff in our residential community.
Okay. Will we receive periodic updates about the number of positive cases on campus?
I think we will. I think that there are plans afoot to develop a community dashboard. That's something that I think is being worked on.
Right. And I think this is part of the public health guidance. So we really want to get everybody involved in this. This is something that ultimately we will all own. Let's see, we shipped bedding and towels to our student's dorm to pick up on arrival. Can she pick up on moving day coming from a retail source? So I think this is like Target is sending towels or something along those lines.
Yes. So I know that students were asked not to have packages arrive before the 24th, I think, if memory serves. And so I think that that's fine, but let me double check on that.
Okay. And can a parent stay overnight in the dorm? I have a single room.
No.
Even if towels are shipped there, the answer is no. All right, so let's go back to the questions, Meg.
How soon will COVID test results? It's super helpful. Like, thank you for all these questions. If we can put them in the Q&A, then it's a bit easier for us to get to them. So how soon will we get the COVID test results? You will get them within 24 to 48 hours of dropping off the turnaround is 24 to 48 hours. I think sometimes it'll be even faster.
Okay. There's a question on isolation, and you've talked about that eloquently before, Meg. Does isolation require moving to a separate location? And if so, who will be assisting the students to move?
So it will require moving to a separate location. Students will get notified if they receive a positive test result, and receive all of the instructions that they need. So they'll get a nice email saying, don't forget your computer charger, here's where you're going, here's what you do. I think we do have plans in place for transportation to help students get their stuff to the testing location. And we're gonna so UHS and the college and all of our partners, so dining services will be working to take students' meal orders and deliver meals for them. Our colleagues in physical resources will be doing trash collection once a day. From the college side, we'll be checking in with students to make sure that they're doing okay. Same with UHS, checking in about their symptoms. So we will be really, I guess, knowing that nobody wants to be in this situation, we're going to make you feel as cared for and looked after as we possibly can in this situation.
Okay. So the next question is Uber Eats question mark. So
that sounds like a Brett question.
I wonder if that's like Andrew trying to make me hungry because I haven't had dinner, and so that makes me think of a burrito, but that's probably not what he meant. No, Uber Eats won't be able to deliver on campus, I think is what the question is. Unless you think I'm misunderstanding the question, Meg.
I don't think so. How quickly will our move-in helpers need to leave? Will they need to leave as soon as all of our suitcases are in our room? Can they stay for a little while to help us unpack? I don't know if we've gone into that level of detail, but can double check the move-in guidelines that were sent out today.
Okay. You want to put that down as a question for us to follow up on?
Sure.
Yep. How quickly? Yep. Okay.
Yeah, I probably can't look that up right now.
Okay.
But Emma, I would just refer back to the emails about move-in guidance as well for a quicker answer. If a student lives within driving distance of campus, are they allowed to go home for a weekend? So we're really asking people to stay on or near campus. The reason we have that policy is that spending time, especially in indoor spaces with others who are outside of the community and not following our same testing regimen, is a risk. So all travel will need to be approved by, all travel outside of the immediate area will need to be approved by the resident dean, and I would expect that would not be approved.
And I think this speaks to, there are going to be sacrifices that we're all going to have to make. I'll be, just put it personally, both of my kids graduated in spring. I didn't get to go to graduation for either of them. It was painful. It was also the right decision by both of those schools. And there are going to be things that are going to be difficult, and we're going to have to do it to keep the community safe.
I just see a question in the chat. How many students will be sharing a bathroom? No more than 3.
And then there's a question about, are we allowed to grab groceries from Trader Joe's after the quarantine is over?
Yes.
Okay. There are other markets beyond Trader Joe's as well.
But are there really? Why would you even bother?
We could have a market basket Trader Joe's argument, but we don't need that now. It was stated that eating may occur outside of one's dorm. Does that mean students would be without masks, which would violate part of the residential compact? We're not going to set up rules that say if you eat, you take down your mask there at that moment. If we decide to expand that, it's going to be clear what's allowed.
Great.
So,
done. We have access to the mailing center. I think so.
okay. So then we have Linda Chambers. Okay. Let's go with the will our boxes from Olympia storage be in our rooms for sure? Can you see it or you want?
Yes.
That's the goal.
Well, yeah, that's the goal.
Exactly. Then we come to one that says, as the last several weeks have shown at colleges across the country, there will be off-campus parties attended by on-campus students. What to do about that? So I will give you at least 2 answers to that, YL. The first answer is that's part of what the high cadence testing program is. If there are people get infected, to be able to isolate them as quickly as possible and not have an outbreak. The second is that we do have a community compact that says that you will follow public health guidelines. So that would be an issue for the council. But the last part is, I know these things can happen. But the reality is for first year students, seniors are going to depend on you. So when people choose to do that, they choose to make the community a less safe community. And we hope that we can get people to choose to make a safer community in which we can all learn. So Meg, we also should keep track of the time. It's 9:24, so you're supposed to remind me that the goodbye slide, but we still got a few more minutes.
Yeah, Brett, don't forget that goodbye slide after a few more minutes.
Thank you, Meg. Where are we? We're at the Michael Mantella's question.
If my suite may test positive and is moved to isolation, is there any protocol for a deep cleaning of my suite? Is it safe for me to quarantine in the now infected suite? So, let's see. So the thing is that like we're less concerned about like I think and this is my non-scientist understanding, but like we are far less concerned about surface transmission than we are about aerosol transmission. So we'll have filters in your suite and like I'm not sure if there will be additional cleaning of your suite, but that's something that we can look to find out for sure.
Okay, I was just scrolling down to see how many questions, whether we're gonna have time to answer all of them. So let's see. Will there be mail package delivery during the 7-day quarantine?
Yeah, we just, according to the email that was sent this morning, packages will be held for you until you've completed your arrival quarantine.
So then we get to Raphael's question, how do we balance encouraging safe socializing on campus with positive incentives to encourage socializing only with on-campus students and not indirectly incentivize students to socialize off-campus? If the on-campus rules are without any wiggle room for, say, a no-guest policy for a lonely senior in single housing. I think this is where we turn to you. This is partially why we want students on the council. This is where we turn to you for us to help us to figure this out. We need to do this in a way that is reasonable and possible, and we look for your input.
And Raphael, I think that we all want the same thing, which is safe socializing on campus. And so once we get through the initial quarantine and know that we've done so safely, we're going to, like, you can be looking out for expectations, which, you know, for how to do this safely. So we're going to be outside with masks on, but we're going to be, you know, we're going to get to spend time together. And we'll be more clear on like what that looks like when we find out exactly, when we see exactly how things are going.
So we have Annika's question, which is about somebody being able to get things as they first move in. I think we've already addressed that. So Sarah's question about transportation provided for move-in testing to the dorms, especially those that live in houses further away, such as the quad. The testing will take place in the house, correct, Meg?
So on move-in testing, it'll be at the Science Center. And then, so if you're arriving by car, you can park close to the Science Center and then move, you know, move your car. And I'm not sure if there will be other transportation provided.
Okay, then there's Samara has a micro fridge question.
will microfridges be in our room from jump? Does that mean like from the
From
beginning?
the start,
I think so.
yes,
Yeah.
that's the goal, is to have microfridges for each student. Andrew Jing asked, you mentioned insta-shipped off-campus violations of the compact. Sort of yes and no, Andrew. Yes, there are things that will cause us to say that a student's behavior is so unsafe that it's a risk to the community. I wouldn't think of it as insta-shipped off-campus. We will give students time to move. We want this to be orderly. We always have been. But we have to address the reality. As another, there was a question about parties. We have to address the reality of extremely unsafe behavior. I do also think as we do this, we look at other schools, right? That UNC was open for 6 days and had to send everyone home, and Michigan State has already decided to send everybody home. We're gonna all have to work together on this. So other questions, Meg, and then I will make sure that I have the last
Sure.
slide.
I'm just gonna like see if any of them are particularly about the compact.
Yeah.
Let's see. So I think that we've answered all the questions that were about the compact, and there are other good questions in here that we don't have time for at the moment. But I think that a lot of these answers, if you look on the Dean of Students Office website and look carefully at the emails that have been sent, I think that you'll be able to find answers. But please do be in touch with the appropriate, whether it's the housing office or your resident dean, to help make sure that you're really clear on what to expect and how to prepare.
So with that,
so as we've tried, just in closing, as we've tried to emphasize over the course of our time together, our first priority here is safety, and we're all of our safety is dependent on all of us in the community. We're also so excited to have you come back. It's really been far too quiet here since March. We've missed you so much, and students are what make this place so wonderful. I feel so hopeful that we can do this. We can do this safely. We can do this in a way that it's as much fun as you can possibly have safely during a pandemic, and we're gonna do it together. We're gonna learn together, we're gonna support each other, and we're gonna be together every step of the way. We really want to be, as we develop this council, we want to be transparent and we want to hear from you. So we hope that you will be in touch with us. We have a brand new community council address, and then these are Brett's and my email addresses as well. So thank you so much for being here with us, and really just so glad to be part of this community and grateful for all of you. Brett, anything else to add before we sign off?
welcome to Harvard. Welcome back to Harvard.